brings together and runs an Italian network providing services and products for the treatment of chronic lifestyle diseases, including diabetic foot care, orthopedic foot care, cardiovascular rehabilitation, elderly care, nutrition, and healthy eating. Using a multidisciplinary approach, Baco network members share a commitment to make their specialist skills and resources available to healthcare institutions, hospitals, and primary care centers. Baco works closely with its clients in the various phases of planning, activating, and managing services, providing products. Baco is at work in many countries, especially those where the population shows a very high diabetes incidence rate. Worldwide, diabetes is soaring to epidemic proportions. 382 million people around the world have diabetes. Over time, diabetes is a leading cause of cardiovascular disease, blindness, kidney failure, and lower limb amputation. Diabetic patient management involves a multi-component care program including diet, physical exercise, foot care, and advanced wound dressing. Pisa University Hospital's Department of Diabetes is home to the Diabetic Foot Clinic, recognized as the best practice in the world in accordance with the International Working Group on the Diabetic Foot Guidelines, thanks to the work of the multidisciplinary team led by Dr. Alberto Piagesi.
Diabetic foot is increasing on this planet, especially in some parts of this planet due to the increasing prevalence of diabetes, mainly type 2 diabetes. This creates a pandemic of diabetes and of the complications of diabetes, which are the most prevalent and devastating clinical consequences of the disease, such as that we expecting a rise in 4-fold to 5-fold in the prevalence of complications such as retinopathy, nephropathy, and most important, diabetic foot.
Diabetic foot is a complex disease affecting the lower limb of millions of people around the world, and its rising prevalence has created a dramatic need for effective therapeutic solutions. Almost 1 in 4 diabetics will suffer from diabetic foot problems at least once in his or her life.
Diabetic foot is a multi-component, multi-pathogenic disease affecting the foot in 1 out of 4 diabetic patients at least once in their life. And the evolution of this chronic and progressive disease is such that at the end the patients with diabetes face an excessive risk of being amputated, which is 20-fold the risk of normal population, and the mortality among patients with diabetic foot is as high as the one of breast cancer, and even higher than some form of colon cancer and prostate cancer. So that these patients create many problems in terms not only of management of the condition, but also the management of the general aspects of their health conditions. This very prevalent, severe, progressive, and life-threatening disease integrated and organized approach to be adequately contrasted.
The International Working Group on the Diabetic Foot has proposed the multidisciplinary, multi-level Diabetic Foot Clinic as a model to fight this complication. The Pisa Diabetic Foot Clinic stands out as a result of its advanced techniques and multidisciplinary approach to patient care, managing to avoid amputation in 85% of all cases.
A diabetic foot clinic is not mainly a facility, but is something more. Is a concept of an organization of work which uses and profit of the different expertise of the different specialists involved in the care in an integrated approach to the diabetic foot. Diabetologists, podologists, radiologists, infectious disease specialists, surgeons, they are all part of this multidisciplinary approach coordinated by a diabetologist, which is aimed in targeting and in addressing all the phases of this condition, from prevention to treatment of the acute phases to rehabilitation.
Organizing and implementing a multidisciplinary and multi-level diabetic foot clinic model within the practice requires a combined, targeted transfer of otherwise shared skills and services. Baco works with its clients to optimize skills and resources around the common goal of ensuring that patients receive effective treatment. Baco coordinates the development and implementation of diabetic foot clinics and can directly manage screening services, risk factor treatment, all orthopedic services for patients with diabetic foot complications and related orthopedic foot problems. Baco Network assists public and private hospitals in making Pisa Diabetic Foot Clinic best practice their best practice. Diabetes is not just a health issue, and concerted policy action across many sectors is required. Baco, in collaboration with Ferrara University, promotes a comprehensive approach to the diabetes-related clinical and social factors like obesity, cardiovascular diseases, and hypertension. At the Center for Research Applied to Sport of the Ferrara University, patients with previous heart attacks are guided to cardiovascular rehabilitation programs. Rehabilitation is based on personalized physical activity plans. Before being admitted to a rehabilitation program, the patient's cardiovascular system is carefully assessed. After being admitted, each patient is guided to a personalized indoor physical activity program. Follow-up cardiovascular examinations are carried out every 6 months. A strong relationship between cardiovascular efficiency and survival has been demonstrated. Furthermore, studies have also shown a strong link between the walking speed maintained during a simple 1-kilometer walking test and survival rates. There was a dramatic reduction in the hospitalization and medical expenses of patients who improved their cardiovascular efficiency during the rehabilitation program. In a nearby center, Ferrara University staff also treat sufferers of obesity, high blood pressure, and type 2 diabetes. Once again, these patients are first assessed and then given a personalized physical activity program. Indoor rehabilitation programs are supplemented by staff-assisted outdoor physical activities appropriate to each patient's physical capacity. Baco coordinates the implementation of assisted physical activity centers and manages training, screening services, rehabilitation and prevention programs for hospitals and rehabilitation centers. Overweight and obesity are preventable. It is important to support individuals in following a healthy lifestyle and educate to choosing a correct diet. Baco's partner can directly manage catering services for communities, schools, hospitals, and canteens, granting access to a range of healthy foods. Increased social awareness of the relationship between diet and health has led to the emergence of new professional cooking methods, ensuring improved quality, such as vacuum cooking. Vacuum cooking represents one of the most important technical innovations that enhances the taste of foods without altering its organoleptic and nutritional properties for every need of catering. Solvite, Baco's partner and a leading Italian company in this field, has optimized processes to allow preparation of any type of food, including those typically associated with the Mediterranean diet. There are two essential differences between sous vide and conventional cooking methods. The raw food is cooked at low temperatures in airtight plastic bags for longer than normal times with precise temperature control.
This method offers many benefits. Sealing the food maintains texture, keeping juice and aroma that would otherwise be lost, and retains vitamins and other nutrients. In addition, airtight cooking guarantees high standard of quality without resorting to chemical additives or preservatives. allowing improved planning and management on the time spent in the kitchen.
I'm Professor Paola Rossi from the Department of Biology and Biotechnology of the University of Pavia. Education in nutrition should be extended to all levels, from the very young people, from child in the school, just to the old men, just to have an healthy aging. More and more young people are developing diabetes with a very early onset. So it's really important to prevent this illness that also is increasing more and more. One of the critical parameters for a nutrition point of view is the glycemic index of the food. Different studies, different scientific studies proved, demonstrated and published that a diet with a low glycemic index could prevent diabetes. Last year, in collaboration with the farm Sovite, the University of Pavia have demonstrated that the products from Sovite for their composition, nutritional composition, and for the vacuum cooking procedure technology are foods with a low glycemic index, so they can be used both in preventing diabetes and also during the illness.
Baco's partner, Sovite, can manage the supply of food through implementation and management of centralized industrial kitchens, the provision of meals to communities such as schools, offices and businesses, the direct management of canteens, as well as the creation and implementation of nutritional education courses for all age groups. Baco manages a value network, a system of partnership and alliances designed to offer substantial opportunity in primary care in order to better handle chronic diseases such as diabetes and obesity before they can lead to chronic complications.